Good morning, everyone, and welcome to the 2026 Annual Sophe Conference. Well, we come from a long line of health educators who have done great things. My term began in April of 2025. We were stepping into a bit of a storm. We found ourselves immediately confronting a landscape of public health challenges that felt at times like it might be insurmountable. And it hasn't really let up. Most weeks, it feels as though we in public health are, sometimes being attacked from all sides. Let's use this time to support each other. Take a moment to thank your friends and neighbors for the hard work that they have done. Let's celebrate what we have accomplished over the last year. Let's draw strength from one another and set our intentions for the next year. Let's go forth into this conference celebrating our strengths and finding new ways to continue fighting together. Thank you, Portland.
We're in Portland for our 78th National Conference. A bunch of people here, 840 some odd people, and they're all networking and learning from each other.
It just gives you a wide variety of resources, both in terms of gaining new knowledge, but also creating relationships with others in health.
It's our professional home. Participated in their events and conferences, as well as being on different committees, and now the Sophe board as a trustee.
This will be the first time that we're really focusing on application of our research.
Yeah.
This is going to actually give us an opportunity, we're doing a deep dive to actually talk to people.
It really encourages our students to learn practice and programs that a variety of different people are doing across the nation.
We don't really have a science problem. We have a trust problem. And here's the part that we don't say out loud enough. We keep acting if people just understood us, that they would agree with us. And that assumption isn't just wrong, it's costing us. And in so many ways, we helped create it. But here's the greatest part about losing trust, is you can actually rebuild it. And that's what I want to talk about today. How the future of public health will not be decided by better data. It will be decided by better relationships, by better trust, by better communication. And being right is important, but it's not enough. One of the challenges in our field is that we're trained to be precise and not persuasive. In public health, knowing is not the same as being heard. And if people don't hear you, they don't act. And if they don't act, that science that we do all the time, it becomes irrelevant. We say people aren't listening, but that's actually not true. People are listening, they're just not listening to us. So trust has to be the thing that underscores everything that we do. It's the foundation of our work. It's the foundation of our relationships. Our values are not necessarily right. So we have to understand that, again, our values at times do not necessarily align with the values of others. But we still have to get them to be healthy. We still have to reach them. It's a universal experience we've all had. So this is how we have to begin moving forward, being more thoughtful about what's the public health that we want to create. Not next year, not in 3 years, but I'm talking like 10 years from now. We're all colleagues and we got to lean on each other to get us through this hard time. And we got to lean on each other to make public health really meet its promise to the American people. Thank you.
Sophe is the voice of our profession. They work to advocate for who we are and what we do and the impact we make in the communities.